Good morning, everybody. Thank you for joining us this morning and welcome to the Children, Youth, and Behavioral Health Initiative kickoff webinar. Happy to have you with us. We have a packed agenda, so we're going to go ahead and get started. Before I hand it over to my colleague, I'd like to just give us a few housekeeping items for the benefit of the order. This is a call for stakeholders only. It is not intended for members of the press or the media. Press and media and members thereof can direct their questions to the CalHHS Office of External Affairs, and I will provide their number in the general chat for everybody. All attendees are on mute and their cameras are off with the exception of the panelists who you may see before you. Questions, when we get to the Q&A portion, tail end of today's webinar, questions will be provided. You can ask your questions in the Q&A portion on the Zoom platform itself. We're going to do our best to get to every single question, but not all questions will be addressed within the 30-minute time frame we have allotted. That means what we're going to be doing is taking a transcript of the entire presentation and putting together a collection of all the questions and then providing answers to each question, essentially in an FAQ format, and we will send that document out to all attendees within a day or two following the meeting. All of the materials for this particular meeting will be posted on the CalHHS website at the end of today's discussion. And we are recording this particular webinar, and we will be posting a link so folks who have not had the opportunity to attend will be able to watch later this week. Also, if you would like to view the live transcript or closed captioning element of today's presentation, feel free at the bottom of the Zoom platform. There is a live transcript CC button. Select that and you will see all of the comments made in real time. Again, thank you for your time in joining us today. And it's my privilege to welcome Melissa Stafford-Jones, the director of the initiative. Melissa, I'll hand it to you.
Thank you, Nate. Good morning, everyone. Welcome. I'm Melissa Stafford-Jones, Director of the Children Youth Behavioral Health Initiative. We're so pleased that you could join us this morning for this webinar about the work of the initiative. You can see the agenda here. We're going to provide some welcoming and overview of the initiative itself. Then we're going to get into each of the component work streams of the initiative and provide you with updates on that work, as well as how stakeholders will have opportunities to engage and partner with us in the work going forward. And then, as Nate indicated, we want to make sure we leave at least 30 minutes at the end of the webinar time to answer as many of your questions as we can. So if you want to post those along the way under the Q&A button, that would be terrific. And with that, I'm very pleased and we're honored to have with us today Secretary Galley to share his thoughts and vision around the Children and Youth Behavioral Health Initiative as we get into the next couple of hours together. Secretary Galley, thanks for being with us.
Yeah, Melissa, Nate, whole team, thank you so much for including me on this important day. I'll just remind folks, about 11 months ago, we put together, maybe 12, now that we're in the middle of March, 12 months ago, we began putting together the vision for California's Children and Youth Behavioral Health Initiative that today we're really kicking off with all the stakeholders. And it's been an unbelievable set of work that has come together over the last 12 months to really recognize where this state is in leading on children and youth issues generally, but in particular, the behavioral health issues that we know young people were experiencing before the pandemic and were exacerbated during the pandemic. And I can't tell you, there's probably not a day that goes by where I don't receive many emails from parents across our state, some from communities in the South, some from the North, rural communities, coastal communities that speak about how hard their kids' lives have been over the past 2 years. I know I experienced that with my own 4 children. The tools that we have at our disposal just aren't enough. And we knew that going into the pandemic. And like I said, they've been exacerbated. So today's conversation and really kickoff is about this amazing investment, not just of dollars, but of human capital, of energy and thought and leadership to really do something that no other state has done. And really lean into solving this important issue to set our future generations up for the brightest future possible, where issues around behavioral health and wellness have clear ways to be addressed and managed, to be picked up early, to be addressed later as well. And this initiative is about upstream prevention and downstream interventions for young people who are suffering the worst behavioral health conditions. There's a piece of this initiative that's about building up the infrastructure. And when I say that, it is, yes, brick and mortar infrastructure, clinics, centers, places where care and services can be delivered, the human capital resources, the workforce that we've been talking about for so long, and how desperate California is to build that up, not just the classifications and the professionals we know, but improving those, making new teams and inviting new individuals and new classifications to join this work, building on so many of the things we learned during COVID around virtual care and the use of virtual tools to help interact when appropriate with young people and their families, to make care and services a little bit more accessible, and in some cases a lot more accessible. This initiative isn't just about what can we do to set up the future 3, 4, 5 years down the road. Yes, it is about that, but it's also about the now. It's about what we can do in months from now. There's a lot that you're going to hear about today that is going to have an impact very soon. We have a lot of questions and concerns about, well, this initiative is terrific, but what's it going to do in the next many months? And I'm sure you're going to hear new ideas about how that can occur as part of the initiatives. And we're welcome and open to additional feedback on what we might be missing. So with every young Californian in mind, under the age of 25, whether they're in an early childhood program or they're wrapping up their college education, we want you to be heard, seen, and know that we're in your corner. And this initiative, if it's done right, and it's done with the vigor that I hope it is, we know that we're going to be a lot better off. And so with the 5 departments and offices that are going to present today, with the 14 work streams that are coming together, this is not reinventing the wheel. This is not trying to tackle every problem that might be affiliated or connected to a youth and behavioral health concern for young people, a behavioral health concern for our children and youth, but it is also meant to align and connect with all of the myriad of other things that are going on in California. So with that in mind, and with the real debt of gratitude to Melissa and the team, to the departments and their leaders, to the staff who've come on board after doing other things throughout our agency to focus on this initiative, to those individuals we've recruited anew, to all of the stakeholders throughout our state who are tuning in today, hearing about the tremendous work, looking for ways to plug in and make their own important contributions. As we talk about within this administration, it's about building a California for all. And this initiative is certainly for all of California's young people. So with that, Melissa, I'll turn it back to you. I hope you have a terrific next couple of hours, and look forward to hearing how it goes.
Thank you so much, Secretary Galley, for being with us and for setting that context and frame for not only the time we're going to be spending together today, but the work we're going to be doing in the coming months and years together with all of our partners and stakeholders. If we could go to the next slide, please. So I wanted to just take a moment to ground us and build on the Secretary's comments in terms of our approach and goals and vision for the Children and Youth Behavioral Health Initiative. As you can see on this slide, a really sort of core to the initiative is reimagining the systems that support social emotional well-being and behavioral health into a more coordinated, equitable, upstream-oriented, prevention-oriented ecosystem. One of the things I've heard from many of our partners in these last several months has been about how the Children and Youth Behavioral Health Initiative is a critical opportunity to address the silos that we have. As the Secretary indicated, there's a lot of work already happening to improve and address the social emotional well-being and behavioral health of children and youth in many corners, in many parts of the state, through many partnerships, programs, and initiatives. And we have an opportunity to build on those bodies of work, those bright spots that are happening. But what I've heard from our partners is that work is often in silos, And as a result, we are not centering the way I think we all want to, the needs, the strengths, the priorities of children, youth, and families. And so this initiative is really an opportunity as part of reimagining the ecosystem to take on some systems change work, to think about how do we take the different components of the system we have, think about how do we sort of reorganize the puzzle pieces in a way that really advances equity and addresses what we know are the inequities in our system, since we know the current system is resulting in the inequities that we see today in terms of both access and outcomes for behavioral health and social emotional well-being for children and youth. And so the work of this initiative for all of us to come together, grounded in partnerships and collaboration, grounded in a commitment to reimagine what that ecosystem could look like in a way that really focuses on equity and centers the experiences and the voices of children and youth and families, that is really our work together ahead, and building that ecosystem architecture as part of the infrastructure that the Secretary talked about in terms of, the bricks and mortar part of it, the workforce, the partnerships that are being invested in, all of which are a critical part of the infrastructure for the ecosystem that we are reimagining together and will be doing the work to plan and implement in the coming months and years. Also want to just note a couple of things about the initiative. As was mentioned, it is for all children and youth 0 to 25. So it includes strategies and approaches for both early childhood, our school-age children K through 12, and our transition age youth and those in higher education, ages 18 to 25, as the Secretary indicated. And while we are focused on all, and you'll hear about some of the work streams today in the initiative that really support that all children approach, such as the all payer approach that is embedded in the initiative for school-based and school-linked services, but that we also have a very intentional equity focus to recognize that we know some children and youth, including our BIPOC children and youth, LGBTQ plus youth, and children and youth and families from low income and underserved communities, we know they face greater systemic barriers to wellness, and that we see that in inequitable outcomes in behavioral health, and the initiative is very committed to addressing those inequities. One of the key ways to take that on is through truly centering the voices, the needs, the strengths, the priorities, and the experiences, the lived experience of children, youth, and families. And we'll be talking later today a bit more about how we are working to do that. As Secretary Galley mentioned, also and you can see on this slide, this initiative also does address the full continuum of care, from strengthening our work in upstream prevention all the way through making sure that services are coordinated and integrated for our children and youth that have the most complex and intensive needs, including working with other initiatives and programs that are working on those issues, and making sure that we are connecting some of the tools we have in the Children and Youth Behavioral Health Initiative to those other tables. Because as this slide notes, the cross-system and cross-sector partnerships are critical to the work of the Children and Youth Behavioral Health Initiative. And the last thing that I want to note is around the context of the initiative is as we reimagine the ecosystem, one of the issues that comes up in our conversation, I think is so important to note in a state as large and complex as California is, the combination of our work together is reimagining the state level ecosystem and the framework for how we're going to build this ecosystem architecture together that really is coordinated and equitable and is improving outcomes for children and youth in terms of their well-being. And we recognize that there are going to be multiple local models for how that work looks in terms of work at the local level, of how those ecosystems are formed and how they function. And so that is part of our work together too, is building on all the bright spots and best practices at the local level and having that inform the state level work we're also doing together as part of the initiative. Next slide, please. Just want to note with this slide how the Children and Youth Behavioral Health Initiative is grounded in the overall commitment of the governor and the administration to the behavioral health and well-being of all Californians, and is aligned with the guiding principles for all of the work of the California Health and Human Services Agency. The CYBHI is a core key component of the administration's commitment and clearly the legislature's commitment on system transformation to improve behavioral health for all Californians, including the recognition of the social determinants must be addressed to achieve improved behavioral health outcomes for all Californians. So with that, we wanted to share with you next a way in creating that. I want to thank all the youth who participated in creating that digital diary so that we could see that together and share that with you as a grounding for our work today and going forward. And hearing from and incorporating the voices and experiences we just did of children, youth, and parents and families is a core part of the work of the initiative. So more to come on that. If we could go to the next slide, I just want to briefly note that the work of the initiative is happening in phases. Much of the work right now, the last several months, has been primarily in the planning phase of phase 1. And we're beginning to move some of the work stream components you'll hear about today are already in the early stages of phase 2. Other bodies of work will be soon be moving into the phase 2 work. So just wanted to note that the different work streams and different aspects of the initiative are on different timelines. But that we have been primarily in phase 1 with some in phase 2 and moving more into the phase 2, which is why we're so pleased you could be with us as we begin that stakeholder engagement around our planning and design of the reimagined ecosystem. And so with that, we're going to turn it over to the presentations by each of the departments to share about the specific work streams that they are advancing. And we're first going to hear from the Department of Healthcare Access and Information. So I'm going to turn it over to Karen Rizal.
Good morning. My name is Karen Rizal, and I'm with the Department of Healthcare Access and Information, or HCI, Deputy Director over Healthcare Workforce Development. Thank you so much for being here today. HCI's work within the Children and Youth Behavioral Health Initiative is focused around building the behavioral health workforce. I want to share with you today an overview of our activities and our plans for stakeholder engagement. On the next slide, want to talk about our work. So our funding and our activities are organized around 2 broad work streams. The first is the broad behavioral health workforce. This work stream includes 8 different modules intended to increase and support the behavioral health workforce. Taken together, it creates a broad strategy to increase the workforce and also build the capacity to train existing and new behavioral health workforce providers. The activities cover a wide range of behavioral health provider categories, including peer personnel, substance use disorder workforce, psychiatrists, primary care providers, and social workers, just as an example. Some of the activities in this work stream specifically cover increasing the capacity of primary care providers to assess and treat behavioral health conditions, building the behavioral health workforce pipeline. We recognize there are significant behavioral health workforce issues now, and that we need to also focus our efforts on building a diverse behavioral health workforce for tomorrow. We also are looking at expanding the capacity of training institutions to train psychiatrists, especially those serving children and youth, and social workers. We also recognize the importance of expanding the substance use disorder workforce. We recognize the severe shortages in this workforce today and the urgent need to train and place professionals to serve those experiencing substance use disorders. We also are looking at providing recruitment and retention opportunities for organizations by augmenting our HCI's existing scholarship, loan repayment, and stipend programs to support a broad range of behavioral health disciplines. But in addition to programs that support this broad range of disciplines, we are also looking at cross-cutting strategies across our programs. These strategies include looking at new models of training for our workforce, such as opportunities for earn and learn or apprenticeships. We have seen the effectiveness of apprenticeship programs to on-the-job learning and support that help people pursue meaningful and rewarding healthcare careers. We are also looking at how we can enhance training for all providers to better serve children and youth, especially serving justice and system-involved youth. Let me turn to the next part of our work stream, which is the behavioral health coach workforce. We are also looking at ways to build the behavioral health workforce to serve children and youth by examining new roles, including a behavioral health coach. This role is still in the early phases of development, but these are some of our current thoughts and objectives for this new role. We think that a behavioral health coach would engage directly with youth, but also ensuring that they receive adequate training and supervision for their work. We also strongly believe that any behavioral health role we create must serve vulnerable populations where people live, study, and work. We also recognize the importance of expanding the diversity of providers. That's an important goal for our initiatives, is that we recognize that we want to expand the number of providers and the diversity that reflects the needs of California. So we need to make any new behavioral health role accessible to those with lived experience and a diversity of background. We are also, as we are planning this new role, we also want to address some of the workforce gaps that exist today. For example, we know that there are a few behavioral health roles for people with less than a 4-year degree. And one of the other objectives for our program is we want to build in career pathways for this role, for a behavioral health coach, that we want it to be a desirable occupation, but we also want to recognize and build an opportunity for people who want to progress to roles requiring more education and experience. Let me go to the next set of slides that talk about our stakeholder engagement. As you have been hearing and will continue to hear throughout the webinar today, we feel strongly in the importance of stakeholder engagement, of listening carefully to all of you. We want to ensure that diverse voices are heard from youth and families and from so many of you already engaged in behavioral health work. I'll talk a bit about what HCI is doing to ensure broad representation as we develop and implement our work streams. You can see here the broad stakeholder groups that we want to be sure to include in our stakeholder engagement. This includes stakeholders representing current behavioral health providers, training providers, and those in the behavioral health workforce. Youth, family, and communities, including advocacy groups. And finally, our governmental partners, those both state and local, including those in education and healthcare. On the next slide, I want to talk about our timeline. We want, as we mentioned, as we're engaging you, we want to show kind of how we're doing it. As you can see, we are currently in our diagnostic phase, starting in January and moving into April. This phase gives us the opportunity to listen and learn from all of you about your behavioral health workforce challenges, best practices, and opportunities. We want to hear about experiences of children, youth, and families, for example, seeking and obtaining the care that they need. We will engage through a variety of means, such as interviews and focus groups. We have met with some of you already and look forward to meeting many more of you as we seek to understand more about California's behavioral health workforce needs. Our design phase, which will start in April, allows us to bring our ideas forward to stakeholders to test, refine, and draft possible solutions and workforce roles. We plan to do this with working groups that provide a solid representation of sectors, regions, and consumers. If you would like to participate in our stakeholder engagement that we are conducting, please let us know. We are strongly committed to hearing from as many of you as we can, knowing that it takes a diversity of input and perspectives to build programs and activities that will build and sustain California's essential behavioral health workforce serving children and youth. Thank you for attending today. I look forward to working with many of you as we create solutions.
Hello, my name is Ana Bolaños. My pronouns are she, her, ella. I reside on the ancestral land of the Nisnan, Miwok, Patwin, Winton, and Maidu tribes. I identify as an immigrant bilingual Latina. I serve as the Assistant Deputy Director for the Office of Health Equity with the Department of Public Health, the California Department of Public Health. I am honored to work on this initiative on behalf of the people we serve in California. My work for the last 25 plus years as a social worker, health educator, and a public health administrator has been rooted in addressing racial and health equities in communities historically marginalized. The California Department of Public Health will lead the work stream to create comprehensive, linguistically appropriate educational and change campaigns. These campaigns will teach Californians how to recognize the early signs and symptoms of distress and where to turn to ask for help. They will normalize seeking mental health support and raise behavioral health literacy awareness in hopes that Californians will understand and support those who have a mental illness. It requires reframing and a narrative change to behavioral health. These campaigns will empower children and youth to take charge of their mental health and wellness, give voice to those historically silenced. In partnership with community leaders, the campaigns will build on existing promising local efforts to develop culturally specific campaigns with the lens of reducing disparities and addressing inequities in LGBTQ, tribal, Black, Latinx, immigrant, migrant, incarcerated, foster care, harm reduction, learning developmentally disabled children. This will accomplish through innovative cutting-edge campaigns. The campaigns will work through social media, educational channels, and youth organizations to raise behavioral health literacy and awareness and normalize help-seeking behavior. Raising behavioral health literacy provides the opportunity to help guide individuals in need towards mental health support. These campaigns will also promote engagement with community-based organizations and other partners to focus on mental health and create a movement to lower barriers to mental health access. Youth will be empowered to co-design these awareness campaigns, which is essential to its success. We will accomplish this by engaging with youth advisory groups to build and expand the capacity of existing educational efforts. 1, increase awareness of mental health issues among school-age youth, emphasizing the importance of peer-to-peer activation. 2, provide culturally and linguistically appropriate training for adults who interact with school-age children to detect and respond to mental health issues in children and youth. And 3, ensure that children and families who may have behavioral health issues have access to appropriate treatment services. We will tap into areas unexpected and non-traditional, such as storytelling, telenovelas, art, theater, and music. Next slide. It's important to engage with our stakeholders. Right now, CDPH, the Office of Health Equity, is meeting with internal subject matter experts that have been identified, including experts from the Center for Family Health and the Center for Healthy Communities. Internal experts have been engaged in defining goals and operating principles for the Child Youth Behavioral Health Initiative public education campaign. We're gathering and synthesizing relevant observations and lessons learned from prior CDPH and state efforts to inform the design of the Child Youth Behavioral Health Initiative public education campaign. We're setting up a team to lead cross workstream coordination planning and execution management. We're going to develop a youth focus and community partner stakeholder engagement plan and then implementing the plan. CDPH will embed a culturally and linguistically responsive framework into the stakeholder engagement plan and process. We want to set the stage for community members to feel welcomed and that your voice are essential to this process. We are committed to engaging with stakeholders in an authentic process. We will build on multi-community channels. We know through collaboration across diverse groups and representatives, the thoughts and ideas are generated and thus innovation happens. The stakeholder plan will include the participation and involvement of youth, family, community-based organizations, and government agencies. Next slide. These are the key milestones that CDPH has outlined for this webinar. In spring of 2022, I mentioned in the previous slide, we're working with creating a subject matter expertise group, an internal one. We're going to do a landscape analysis of internal stakeholder engagement. We know and want to prevent from having a stakeholder fatigue, reaching out to all the different, the various stakeholders or duplicating our efforts. We'll develop a stakeholder plan. And in the fall of 2022, we will engage stakeholders, youth, and community partners. And in the spring of 2023, we will release an RFP for public comprehensive linguistic public education and change campaigns. And by the fall of 2023, we should be able to award and launch the educational and change campaigns. I understand, and we understand, reimagining and transforming the children youth behavioral health ecosystem requires intentional and inclusive planning. We will accomplish this together. The success is dependent on us working together. Thank you for your time.
Hello, my name is Julie Rooney. I'm the Communications Director for the Office of the California Surgeon General. Today, I'm going to take a few moments to talk about the Adverse Childhood Experiences, or ACEs, and Toxic Stress Public Awareness campaign we will launch later this year. And we're so grateful to have the opportunity to get the word out about ACEs, especially after the trauma children and families have experienced as a result of the pandemic. Our objectives for this campaign: to create public understanding of ACEs and toxic stress so that Californians understand what ACEs are and how they can impact our health, both mental and physical, and to offer messages of hope that toxic stress is a treatable health condition and there are resources available for screening, treatment, and prevention, and to share practical strategies for buffering care that parents and caregivers can provide to reduce the impact of ACEs on children and youth. Next slide, please. Our target audiences for this campaign are parents and caregivers of children and youth, with a focus on economically disadvantaged communities, LGBTQ+ communities, communities of color, immigrants and refugees, rural communities, justice and system-involved youth, and our secondary targets: healthcare community, childcare community, educators, legislators, and other decision makers, to ensure understanding of ACEs and how to build a trauma-informed state. Next slide, please. Stakeholder engagement is so important, and for this campaign, we will be recruiting a panel of subject matter experts to inform campaign strategy and messaging, and to serve as professional reviewers to ensure the messaging is scientifically correct and resonates with our target audiences. We'll be leveraging focus groups and surveys to inform campaign development throughout the campaign, to engage public understanding of ACEs, and we will collaborate with other state agencies conducting ACEs campaigns to align messaging, understand best practices and lessons learned. And we are considering a campaign that includes community events throughout California where families can learn more about ACEs, toxic stress, and buffering care. Next slide. Funding for this campaign is from the 2021 Budget Act and includes $24 million for public awareness campaign activities. Efforts to date: February 4th, we posted the RFP. March 4th, we responded to proposer questions. And on March 22nd, it is the final date for proposal submission. On the week of May 9th, we plan to post the notice of intent to award. And the week of June 6th, it is the proposed agreement award date, with late summer being our campaign launch. We look forward to continuing this conversation as we develop this campaign. And I'm going to turn it over to my colleague now to talk about the educator training. Thank you so much.
Thank you, Julie. Hi, everyone. My name is Kristen Kiner, and I work with the California Office of the Surgeon General. And another project that our office is very proud to be a part of is the Trauma-Informed Educator Training. And the Office of the Surgeon General has been given funding from the state in order to better enable early child care providers, educators, and school personnel to do the following things: to recognize the risks of ACEs and toxic stress, to respond appropriately, to intervene early, and to provide the really important critical buffering support to children that can help to counteract these ACEs, as Julie was mentioning just a moment ago. So this will be 6 total hours of online training that are available, divided into 3 2-hour modules. And the modules are divided for educators and caregivers of children anywhere from 0 to 18 years of age. And we do recognize that this will just be an introduction to this idea of trauma-informed training. We know many teachers already do have a background, and this is not intended to give teachers more responsibility, and it really is intended to let them be aware and to, as you see on your slide, recognize, respond, and intervene in ways that can be beneficial and helpful to young people, and also know about what resources are there that they can use as well. Next slide, please. Oh, and we also, regarding funding, we did receive $1 million from the state in order to fund this project. A few milestones we have coming up currently now, spring 2022, we are very close to getting our contract signed with our contractor who is going to develop and produce our training and get that work started very, very soon. This spring and summer, we'll have our first convening with a group of subject matter experts, and that will be national experts in toxic stress. There'll be physicians, there'll be people with classroom experience. We want to get lots of different perspectives to get their eyes on this training so we can make it as thorough and helpful as possible. And then our aim is by fall 2022, so the beginning of the next upcoming school year, that the training will be available to all educators in the state of California. And then after educators have had a chance to take this training in winter 2022 and spring 2023, we'll be doing an evaluation where we want to get feedback from educators and those who have experience with the training, just in order to understand the efficacy of the training and to again make sure that it is the most thorough training that it can be. Next slide, please. So as everyone has said, stakeholders are very important. We're going to use them in a few different ways with this project. So I mentioned our subject matter expert review panel. Again, there'll be people with science backgrounds, education backgrounds, early childhood backgrounds to guide us along the way as we're creating this. There will be a review of the pilot curriculum when it is first created. There'll be a smaller set of childcare providers and educators who take the training and give us feedback in order for us to get it ready for rolling out to all California educators. And then, of course, we'll have that evaluation of our first large implementation to give us feedback on how things went. And because stakeholder engagement is so important, we would love to get any feedback from anyone listening today. You can see an email address at the bottom of the slide there. You can email us at osginfo@osg.ca.gov, and we'd love to hear your feedback. And we're looking forward to giving you updates on this project. And we are really, really happy to be a part of this initiative. Thank you.
All right, good morning, everybody. My name is Autumn Boylan. I am the Deputy Director for Strategic Partnerships at the Department of Healthcare Services. Today, I'm going to share a little bit more information about the work streams that DHCS is responsible for. On the next slide, see a timeline of the various components of the Children and Youth Behavioral Health Initiative that DHCS is responsible for. Some of the components of the initiative were launched in fiscal year 21-22, including the Student Behavioral Health Incentive Program, which is a program that provides incentive payments to managed care plans to enhance school-based partnerships and services between the managed care plans and local education agencies. We also have launched the Behavioral Health Continuum Infrastructure Program. There is a listening session tomorrow, as a matter of fact, focused on the continuum infrastructure for children and youth specifically. And so there will be information posted at the end of the slide deck for DHCS that has a link to the Behavioral Health Continuum Infrastructure Program website, which has information about that listening session. We also are continuing our efforts related to the CalHOPE Student Services Initiative. Hopefully, those of you who are in California have seen the evidence of CalHOPE. It's been everywhere. I know in my own neighborhood, there's a billboard for CalHOPE. There have been commercials and lots of media campaigns focused on getting the word out around the services provided through the CalHOPE program, which was stood up by the department during the public health emergency era and funded through federal dollars received from FEMA. But we've expanded that program to include a focus on student support services and are engaging with county partners across the state of California to really enhance the availability of social emotional learning environments at school campuses through the CalHOPE initiative. There have also been a lot of materials put together with input from young people around mental health, and those resources are all available on our website. Today, I'm going to focus the discussion a little bit more on some of the other initiatives that we have under the Children and Youth Behavioral Health Initiative, including scaling of evidence-based practice grants and the School Link Partnership and Capacity Grants, which will both launch later this year in fiscal year 2023, as well as the implementation of the Dyadic Services Benefit, which will go live in January of 2023. And in 23-24, so in January of 24, actually, we'll be launching a behavioral health virtual services and e-consult platform, a statewide fee schedule, and behavioral health provider network. And prior to the launch of those two components, we'll be conducting training for pediatric providers and primary care physicians to orient them to this new ecosystem and the platform. Next slide, please. This is an overview of the early thinking around the behavioral health virtual services platform and thinking through some of the components. Our team has been very busy over the last couple of months conducting a very comprehensive landscape analysis, looking at available technology-enabled behavioral health services that exist in the market today. We have looked at over 450 different platforms to see what are the capabilities that exist in the field, and have really been starting some initial conversations around what capabilities we might include in this behavioral health virtual services platform. We plan to convene a panel of experts through a behavioral health think tank who will help to advise us on the functions and capabilities of the platform, including how to operationalize and make real for people, for children and youth specifically, to be able to use this platform to engage with behavioral health services statewide. The platform will include functionalities, including having opportunities for behavioral health screening so that children and youth and their families can get more information about the mental health and substance use disorder conditions, symptoms, and screen for potential issues related to mental health conditions. Well, there will also be a component that allows for short-term counseling and peer and coaching supports so that children and youth can directly receive support through the behavioral health virtual services platform in a limited capacity by providing live and virtual coaches, peers, and access to behavioral health licensed providers. There will also be a host of interactive educational resources, tools, and games that help children, youth, and their families learn more about behavioral health, wellness, and strategies for managing wellness as well. There will be a built-in CBO network to provide some of the services that will be available through the platform, as well as to create a referral network so that if a child's and youth's needs exceed what can be provided through the platform, there's a network of providers kind of standing by to be able to meet those needs, as well as the ability to provide referrals or warm handoffs directly to the County Behavioral Health Department, the commercial health plan, or the Medi-Cal managed care plan. There also, lastly, will be a function for primary care physicians and pediatricians to be able to consult with licensed behavioral health professionals, including psychiatrists, so that there's a wider access to consultation for primary care physicians who are treating the behavioral health needs of their patients. We plan to launch this behavioral health virtual services platform in January of 2024, as I said before, and we'll be engaging in a fairly extensive stakeholder process over the next several months to be ready for a procurement, which we will release at the end of this year. Next slide. We also are leading the work related to the SchoolLink fee schedule and behavioral health provider network. This is an all-payer fee schedule, meaning that the Medi-Cal delivery system, including the Medi-Cal managed care plans and the county behavioral health plans, as well as commercial health plans, will be required to reimburse providers for a predefined set of services for outpatient mental health and substance use disorder services provided to a student at or near a school site. And this applies for all children ages 0 to 25. The SchoolLink fee schedule will include a scope of services spanning mental health and substance use disorders, as I said, and we'll be engaging in a stakeholder process to ensure that we have input on what services are included in that statewide fee schedule. We're collaborating closely with the Department of Managed Healthcare. It's going to talk a little bit more about this work stream later in the webinar, since the fee schedule does apply to commercial health plans as well. And finally, just want to note that we will be also, as part of this work, establishing and working closely with Healthcare Access and Information Department to establish a SchoolLink statewide provider network of providers who are delivering services at or near a school site. Next slide. We also will be issuing grants in fiscal year 22-23, likely opening up the application period for the grant starting in December. And these grants will support new services to individuals 25 years of age or younger from schools, providers in schools, affiliated CBOs, or school-based health centers. This work will very much be linked to and support the work that we're doing related to the SchoolLink fee schedule and the behavioral health network of providers to ensure that there's appropriate linkage and integration between all of these components of the work that we're doing. We're also very much considering the work that's been done with the Student Behavioral Health Incentive Program to make sure that we're providing a complementary grant initiative that really fits in nicely with the current landscape of school-based services. We're also partnering with the California Department of Education to make sure that we understand the community schools infrastructure and kind of the needs at the local level. And we'll be engaging with stakeholders heavily to determine the appropriate grant design for the SchoolLink partnership and capacity grants, as well as those eligible entities. The budget does include $550 million in total over the next 2 years, with $400 million allocated for preschools through 12th grade and $150 million allocated to institutions of higher education, with 2/3 of that higher education allocation being earmarked specifically for community colleges. On the next slide, you see the potential recipients as identified in the statute and the trailer bill. local education agencies, institutions of higher education, publicly funded childcare and preschools, health plans, CBOs, behavioral health providers, county behavioral health departments, and tribal entities are all being considered as potential recipients, and we'll be talking with stakeholders in great detail in terms of where we focus our efforts. We've already heard there's a lot of attention and focus and need for additional services to be provided for the 0 to 5 population. And so working with partners in the early childhood education space to better understand how we can support childcare and preschools through this grant initiative. Next slide. We also will be scaling up evidence-based practices through a grant initiative, and we are convening stakeholders to select a limited number of evidence-based practices and community-defined promising practices to scale throughout the state based on robust evidence, impact on racial equity and sustainability. These grants will be administered through a third-party grant administrator, and we have $429 million in fiscal year 22-23 to issue grants for these purposes. We plan to enter into an interagency agreement with the Mental Health Services Oversight and Accountability Commission, and 10% of the total funds will be earmarked for the commission to assist DHCS with the implementation of the evidence-based practices that are selected through our stakeholder process. On the next slide, you see the potential recipients for these grants include both the Medi-Cal managed care plans and commercial health plans, CBOs, behavioral health providers, county behavioral health departments, and tribal entities. But again, we'll be working with our stakeholder group to better understand and make decisions around the grant design and eligible recipients for the grants. Next slide. This is an overview of our stakeholder process, which will be extensive. There will be many different models that we'll use for stakeholder engagement, including convening some think tanks specifically to workshop ideas around the evidence-based practice grants and the behavioral health services platform. We'll also be conducting listening sessions across the state to engage our partners in education, community-based organizations, health plans, and counties to better understand the needs related to school-based behavioral health care services. We'll be conducting focus groups in partnership with the California Health and Human Services Agency and our other partners within the state have presented today to make sure that we're working in collaboration and across departments to speak to stakeholders about the various components of the Children and Youth Behavioral Health Initiative. And we'll be conducting those focus groups specifically with children, youth, and families, as well as other groups, but really want to emphasize, and Melissa spoke earlier today, about our emphasis on hearing from youth voices and making sure that we're designing work streams, specifically like the platform, for example, that will really be a platform that students and youth and children will want to use, that their families will want to use. So that youth voice is super important. Also want to mention that there will be tons of opportunities for public input, and DHCS will be hosting regular webinars to share information that we're learning through our think tank, through the roundtable meetings, and all of the various other stakeholder engagement activities, and bringing that information back to a public space to make sure that we're sharing with a larger audience of people and hearing from folks about the input that you have for the initiative. Next slide. I already mentioned that we're launching two Children Youth Behavioral Health Initiative think tanks focused on the platform and the evidence-based practice grants. We actually put out a stakeholder announcement on Friday of last week and have opened up the application period for the think tanks. There's information posted on our website, and the think tanks application is linked to the presentation. If you're interested in participating, we encourage you to apply to be a member of the think tank, and we'll be considering all applicants and making selections after the application period closes. The slide says March 21st, but we actually extended that, so my apologies for not making this update. The application period is open through March 23rd by close of business. On the next slide, There is a link to all of the information on the DHCS website, including contact information. You can reach us at CYBHI@dhcs.ca.gov. We also have information generally about DHCS's work streams related to the Children and Youth Behavioral Health Initiative on our webpage, and specifically have information posted about our think tanks and the application period for the think tanks posted on the meetings and events page that's linked there through our website. There's information about the Student Behavioral Health Incentive Program posted separately on the website, as well as information about the Behavioral Health Continuum Infrastructure and CalHOPE student support. So really invite you to take a look, and we'll continue to update our webpage as more information becomes available. And thank you so much. I look forward to your questions.
Great. Well, thank you, everyone. I'm Amanda Levy, Deputy Director, Health Policy and Stakeholder Relations for the Department of Managed Healthcare. Again, thank you for having me here today as part of this exciting kickoff webinar. The Department of Managed Healthcare's mission is to protect healthcare consumer rights and ensure a stable healthcare delivery system. As of today, we protect the healthcare rights of 27.7 million consumers, representing over 95% of people in state-regulated commercial and public healthcare enrollment. As part of the Children and Youth Behavioral Health Initiative, commercial health plans will be required to reimburse for behavioral health services for individuals 25 years of age or younger, provided or arranged by a local education agency or a public institution of higher education. These services will be provided without utilization management and shall not be subject to copayment, coinsurance, deductible, or any other form of cost sharing. The initiative details that the commercial health plans will reimburse at the greater of the contracted rate or the to-be-released fee-for-service reimbursement schedule published by the Department of Healthcare Services. The initiative further references the definition of mental health and substance use disorder in the Health and Safety Code and in the Insurance Code. This includes the recent expansion of state mental health parity statute, which since January 1st, 2021, has required all full-service health plans in the group and individual markets to cover treatment for all medically necessary mental health and substance use disorders listed in the most recent version of the Diagnostic and Statistical Manual of Mental Disorders, referred to as the DSM. Our department, the Department of Managed Healthcare, is tasked with implementing and enforcing mental health parity in the state. Pursuant to the Children and Youth Behavioral Health Initiative, the Department of Managed Healthcare will issue guidance via an all-plan letter by December 31st, 2023, to address commercial plan coverage for the school-linked services. The department will then consider whether regulations are needed and will commence enforcement activity beginning January 1st, 2024. The Department of Managed Healthcare is looking forward to participating with the Department of Healthcare Services stakeholder process in spring 2022, as we anticipate working closely with the Department of Healthcare Services on the development of the fee schedule, including scope of services. After that initial foundational work has occurred, we will then move to our smaller work group model with our health plan associations, education, and consumer stakeholders later this year and into 2023 to dive into the details of contracting and billing, with the goal to ensure access to services for all children aged 0 to 25. We will also be providing relevant Children and Youth Behavioral Health Initiative updates at quarterly DMHC stakeholder meetings. Department of Managed Healthcare has also engaged the California Department of Insurance, who have mirrored requirements in the initiative for the enrollees covered in the plans they regulate. Thank you again for your time and attention today. We understand how critical these services are and strive to ensure there is no wrong door for our youth accessing behavioral health services in this state. Thanks to all my colleagues. This is Melissa Stafford Jones again with the Children and Youth Behavioral Health Initiative. Just wanted to spend a moment summarizing and going into a couple of specifics around some stakeholder engagement work that's upcoming related to the initiative overall. So if we could go to the next slide. So just to clarify some of what you've heard today, on the right side of this slide, you have heard from the various departments today the many ways in which they are planning to engage stakeholders related to specific work stream components in the coming months and even the coming years. On the left side of this slide, just wanted to note that we are also thinking about stakeholder engagement in the context of the initiative overall. In particular, if you could go to the next slide. In the next couple of months, we are very focused at the initiative level around working with stakeholders and partners to help articulate and define what will be different about this reimagined ecosystem of behavioral health for children and youth in 5 years if we are successful in doing this work together, and what should be the specific outcomes goals at the 5-year marker and potentially beyond. We'll start with the 5-year marker for the reimagined children and youth behavioral health ecosystem. And so we're doing that work in a couple of ways. The first is we are working with a set of partners who are trusted partners in their communities to engage with youth and parents in focus group discussions to really contribute to and help shape and inform what those systems goals should be at the end of 5 years and what the specific outcomes goals should be. Secondly, we're working with various stakeholders through existing forums to get a wide range of input from stakeholders and partners. So for example, at last week's Behavioral Health Task Force meeting, which is the governor's task force for advising on behavioral health matters, the members of the task force, as well as members of the public who were part of that meeting, had an opportunity to break into small groups and give us feedback and input and help shape what those 5-year outcomes goals should be. And we are working with other partners to try to build on existing forums where stakeholders from across the different fields and sectors are engaging in this work and really being able to have these conversations in those forums. And then lastly, we are also working on for late spring and into the summer, working to plan a series of community-based, community-grounded engagement sessions to also inform the development of the 5-year outcomes goals for the initiative. And then just want to note that those are the focus on the near-term activities, and you can see on the right-hand part of this slide, both at the initiative level, the way in which we are thinking about continuing stakeholder engagement over time, both for individual work streams and at the initiative level. And so with that, I really want to thank everybody for being on the webinar today. I want to express appreciation for all the hard work of my colleagues in the departments who presented today. And with that, I'm going to turn it back over to Assistant Secretary Nate Mitchell, who's going to lead us through the Q&A. Remember, you can post your questions in the Q&A. We're going to do our best to answer questions now, and any that we don't get to, as we mentioned, we'll be putting together an FAQ-like document to try to provide further information. So let me turn it back over to Assistant Secretary Nate Mitchell.
Thank you, Melissa. All right, so as Melissa stated, we'd like to have an opportunity to hear from you and respond to as many questions as we can. Our panelists, our workstream leads, will do their best to respond to your questions. As Melissa indicated, if we don't get to every question, we are going to be posting an FAQ, which will have a compilation of all the questions that were asked during this webinar and responses from each respective workstream lead. So that will be additionally posted to our CalHHS website. So feel free to send questions. I'm seeing a few come in. So the first question I have here will be for DHCS. The question is, will the DHCS landscape analysis on the Behavioral Health Services platform be available to the public? And if so, when?
Thank you for the question. We will be sharing information about the market scan as we progress through the stakeholder process. I don't know yet the timing of when that will be shared, but it'll likely be shared in April or May.
Thank you, Autumn. Looks like we have another for you. Will the e-consult and the virtual platform be live and in real time?
So I think these are important questions that we'll need to address through our stakeholder process in terms of how the e-consult feature of the platform will function, and we'll be working with a variety of stakeholders who are doing this today and have e-consult platforms live today. And so I think we're still kind of in learning mode and don't have answers to all of the policy and operational questions about the behavioral health virtual services platform yet, but these are really good questions that we'll take note of and make sure that we're thoughtful about making it available. And also just noting, in the digital diary that we heard earlier, one of the comments that really resonated with me from one of the young people was that it's helpful to have support, whether that's through a live support or a virtual assistant 24/7. And that's definitely one of the things that we're thinking about how to operationalize through the website. So there will be some live components of the behavioral health virtual services platform, but it's still kind of to be determined what that exactly entails and how we operationalize that for all components of the platform.
Thank you, Autumn. The next one is for HCI. Thank you for the webinar. In terms of building a behavioral health workforce pipeline, what will be done to increase the diversity of the behavioral health workforce to serve children and youth with a shared cultural and racial background?
Well, thanks for the question. As I mentioned earlier, building the behavioral health pipeline is really important to us, and building that diversity. And so what we're looking for is really engaging and understanding and listening to all of you in terms of how we can better build that diversity into our pipeline. So part of it is reaching out and learning about where are the areas that we need to reach into and build that pipeline into the behavioral health workforce. So we look forward, if you would like to be part of our engagement, please let us know, because we would love to hear from you.
Thank you, Karen. Looks like the next one is also for DHCS. Is there a timeline for when the school-linked partnership and capacity grants will be released? Similarly, are those grant opportunities for existing programs who would otherwise like to expand?
For both the schooling partnership and capacity grants and the evidence-based practice grants, we plan to release the initial phase of the grant application period in the fall and open up the applications for people to be able to apply for those grants in December of 2022. We'll be engaging with stakeholders over the next couple of months, and are currently planning a series of listening tours with education partners, CBOs, plans, and counties starting in April. So just in a few weeks, we'll be launching that initiative. We're working with our partners at the Healthcare Access and Information Department and the Department of Managed Healthcare to co-design the interview guide for those listening tours so that we're all working collaboratively in our stakeholder engagement efforts.
As a follow-up, Autumn, to the extent possible, could you respond, will there be any interface between this initiative and the work of CalAIM?
We're trying to be very thoughtful about the landscape of behavioral health and healthcare services statewide. And that's true, I think, across all of the initiatives under the Children Youth Behavioral Health Initiative. So we're really having discussions as a cross-departmental team to think about where the Children Youth Behavioral Health Initiative fits in with other existing initiatives that exist in the landscape today. So for example, with CalAIM, we're really looking at from the behavioral health perspective, you know, the no wrong door and the screening that is being used through, or that's being developed through the CalAIM initiative, and how we might be able to leverage those existing resources, or those resources that are being developed through that initiative, through the behavioral health virtual services platform. And that's just one example. We're really trying to be thoughtful about where the Children Youth Behavioral Health Initiative fits into the larger structure through CalAIM. We're also working closely internally at DHCS with our partners in our population and quality and population health management team, thinking about, you know, from a population health perspective, from an equity perspective, the measures that we're putting in place, DHCS's quality strategy, and how the Children and Youth Behavioral Health Initiative can advance our quality strategy at DHCS as it relates to children in the Medi-Cal program. And so very much trying to be thoughtful about where this fits into the larger picture. And the Children and Youth Behavioral Health Initiative is also a part of kind of the larger strategy around Medi-Cal strategies and opportunities for children and youth in the Medi-Cal program, when we had a webinar about that initiative yesterday too. So more information could be added to the chat to give folks resources to find information about how this all fits in with the larger picture.
Thank you. This question could be for Melissa and other members of the panel. Is the Behavioral Health Task Force overseeing and integrating the work of any of these CYBHI components, or is that task force working on a separate effort?
Thanks for the question. So the Behavioral Health Task Force is a body that's providing advice and perspective and insights and guidance around the work of the Children and Youth Behavioral Health Initiative, along with many of the other stakeholder forums that you heard about today. So yes, they are helping us think about at sort of an initiative level, what is the work, and helping us to see connections to other bodies of work, and to really help inform and guide and shape the work of the initiative through the Behavioral Health Task Force, but in other forums as well, as you heard about today.
Thank you, Melissa. Another question: what is the role of managed care plans with respect to this initiative?
The managed care plans have roles in several components of the initiative, and this is, you know, to emphasize comments that we made earlier in the webinar. The Children Youth Behavioral Health Initiative is all payers, so there's a role for both the Medi-Cal managed care plans, the county behavioral health departments, and the commercial health plans. For example, I spoke earlier about the statewide fee schedule and the services that will be provided and reimbursed by the Medi-Cal managed care plans and the commercial health plans through that fee schedule starting in January of 2024. There's also the Student Behavioral Health Incentive Program, which is the incentive program for managed care plans to increase partnerships and capacity for school-based services. And that program is already live and operational, and all of the Medi-Cal managed care plans have opted in to that initiative and are participating in that incentive program. There's also a role in terms of the behavioral health virtual services platform and connecting people to care beyond what is provided in the platform. And we'll be working closely with the Medi-Cal managed care plans, counties, and the commercial health plans to make sure that we are thinking through the platform and that the health plans are drivers of kind of getting their enrollees to participate in the platform. And Amanda, I don't know if there's anything else you want to add on the commercial side.
Excuse me. Yes, I would add the role of the managed care plan is to reimburse for services for their enrollees at a school site or near a school site, both on the plans regulated by the Department of Managed Healthcare and the plans regulated by the Department of Insurance. So that's on the commercial side. We'll be focusing a lot of our stakeholder work after this initial round of having a defined the fee schedule and scope of services in working with the managed care plans on any contracting and billing issues. So we look forward to working with everyone on that.
Thank you both. For HCI, regarding workforce development, can you provide more detail on how you're thinking about building capacity for coaches versus peer supports? Will coaches and peers be used interchangeably, or will one require greater training than the other?
So that's something that we're still working out, but we see them right now as having distinct roles and responsibilities in the behavioral health workforce. So that's something that we're still trying to determine, especially as I talked about with the behavioral health coach role, is really what unique role that plays. But we do see peer personnel and behavioral health coaches as being distinct.
Thank you, Karen. Okay, next question. Thanks for the presentations. What is the role of regional centers and also the community-based organizations funded through regional centers who serve children and youth with developmental disabilities, but who also may have mental health and behavioral health needs? How should they be engaged under the implementation plans for this initiative? And this is a question really for the entire panel.
This is Melissa. I'll start. Thanks for the question. So yes, actually, although the Department of Developmental Services is not a lead entity for a specific work stream component of the Children and Youth Behavioral Health Initiative, they are a part of our internal working group, the same for the Department of Social Services. So that to the point of this question, that we can identify where there are connections that could and should be made for children and youth with developmental needs who also have behavioral health needs. So that is part of our planning and development of the ecosystem, is to make sure that although, as I mentioned earlier, and as the Secretary indicated, that every body of work that is needed to address improving behavioral health for children and youth is not necessarily in the context specifically of this initiative. We are very committed to making sure that we're making connections to other tables, other forums where they are focused maybe on specific populations, and where some of the work and some of the components that you heard about today of the Children and Youth and Behavioral Health Initiative could be brought to bear to better support the well-being and behavioral health of those children and youth. So yes, we're very committed to making the connections across systems.
Thank you, Melissa. Another question here for the panel. Over the years, many initiatives have been implemented in mental health, but no mechanisms to measure impact or outcomes were designed nor implemented. So is there a designated entity responsible for oversight and who will be accountable to report on outcomes for the CYBHI? Without data collection, analysis, and reports, how can we know if this was successful, where weaknesses exist, or what can be expanded?
This is Melissa. I'll start, and then some of my colleagues might want to share their thinking as well. So for the initiative overall, we will be conducting an evaluation of the initiative. And as I mentioned earlier, we will be establishing 5-year outcomes goals for the initiative overall. We will be partnering with an evaluator to do the evaluation of the initiative, including helping us track our progress and ultimately outcomes on those 5-year outcomes goals. I also want to note that we are very much thinking about how to ensure that the guiding principles and values of the agency overall and of the initiative specifically are embedded in the evaluation process. So very much thinking, for example, about how equity will also be centered in the evaluation process. But yes, we will be working with an evaluation partner to conduct an evaluation of the initiative.
Thank you, Melissa. Okay, question for both DMHC and DHCS. This individual is wondering how these initiatives will be shaped for Northern California's rural, underserved, and provider shortage areas with limited access to care and availability of contracted commercial health plans.
Well, I think we'll continue to look at technology and see where telehealth fits in and to be able to serve students in rural areas who might not have access to those services. And I think at this point, we just want to ensure that if students are at school or at a near a school site, they will be able to receive the services. So I actually think kind of having that linkage in rural areas or not, will be able to provide more services than are currently offered today.
I'll just also add that, through the schooling partnership and capacity grants, the statewide all-payer fee schedule, and the behavioral health virtual services platform, it's our goal and our hope that we're able to reach students in the more rural areas through these initiatives. And we'll definitely be engaging with stakeholders around the needs in rural populations to make sure that we are thoughtful about how we use these dollars that are available through the initiative to support the needs for all students statewide, and that includes in those rural areas of California, both in Northern California and in Southern California, where there are rural pockets. So definitely on the forefront of our thinking in terms of looking at needs statewide and wanting to fill gaps that exist in the current delivery system, and we'll be very thoughtful about that as we move forward, and definitely look forward to any specific input that folks have about how we might be able to best leverage the funding that we have available to support rural communities. And again, you can reach DHCS specifically about that at CYBHI at dhcs.ca.gov.
Thank you. Okay, another question. How will the state address access to Medi-Cal optional benefits, such as certain drug Medi-Cal ODS services or peer support specialist services, which may not be available in every county? Will this be limited to only those services available throughout the state and across payers?
So in terms of the statewide fee schedule, I think those are all good questions and things that we need to consider in terms of the scope of benefits that we'll make available through that statewide all-payer fee schedule. Also considering how we utilize peers in terms of the platform, and what is the role for peers in school-based service environments as well. And so, again, as I mentioned earlier, there's a lot of policy and operational questions that we haven't yet answered, but these are all really good questions to bring to us through these forums so that we can be thoughtful in thinking about how we really manage implementation, and that we're thinking through all of the policy and operational considerations, such as optional benefits and availability of certain prescriptions under the DMC ODS. Really we'll be engaging with a lot of stakeholders on the substance use disorder services side to make sure that we're making the appropriate decisions about where we land with all of this work.
Thank you, Autumn. Okay, question perhaps for Karen and Melissa. Once the new workforce has been developed, what provisions are in place to sustain the employment? Specifically, how will their services be paid?
There we go. I was trying to unmute myself. We thank you for that question, and that's one of the things that is important to us in terms of as we're developing new workforce roles, as we're building the workforce, is that we look at sustainability and how to ensure that. And so that is part of the work that we're doing now, is trying to understand how we can build that into sustaining, because as we're talking about building a workforce now and into the future. And so we're in the process of understanding how best we can do that.
I'll just add, thank you, Karen, that we are very cognizant of the question of sustainability overall, that part of working together to develop and reimagine and then build this stronger ecosystem for behavioral health for children and youth is thinking about sustainability. As I shared earlier, we've heard about many best practices and bright spots, and also hear from our partners that those are sometimes challenged to scale and to sustain and to make systemic. And so I think it's really an important question that you've raised in the context of the behavioral health coaches, but also for the work overall, and that we intend to really take on that question of thinking about what are the various ways in which we build a sustainability and a funding infrastructure that supports this ecosystem going forward. As you know, many of the investments in this initiative are one-time investments that are meant to help build the infrastructure that the secretary talked about in terms of the bricks and mortar, in terms of the workforce, in terms of this architecture for the ecosystem, investing in the partnerships and collaborations that we know are essential in order to build a more coordinated child and youth centered ecosystem. And so thinking about what is the sustainability, and clearly some of the components of the initiative are meant to address that, such as the all-payer approach, but there are additional to that. We know we have to think about that question of sustainability and look forward to partnership around that.
Thank you. Okay, next question for DHCS and managed healthcare. Will the statewide fee schedule account for the vast differences in cost of living throughout the state? We have some serious challenges in that regard with the LEA BOP program that discourages schools from participating, and I'd hate to see that same issue carry over.
I appreciate the comment, and we'll take that into consideration as we're thinking through the fee schedule design.
Thank you. Okay, for Melissa and Autumn, can you please talk about the relationship between DHCS and the MHS-SOAC, the Mental Health Services Oversight and Accountability Commission? How did this come about, and what is the role of the commission itself?
Hi, thanks for the question. We're working closely with the Mental Health Services Oversight and Accountability Commission. We've had a couple of meetings with Toby Ewing, and we'll be partnering with the OAC on the evidence-based practice grants initiative. And I mentioned earlier in my presentation that part of that partnership will include an interagency agreement so that the Mental Health Services Oversight and Accountability Commission can support the work that we're doing in terms of the evidence-based practices, and that we in turn can support the commission with the work that they've done to lead the way related to evidence-based practices statewide.
And I would just add that the Children and Youth Behavioral Health Initiative overall also did include $205 million to the Mental Health Services Oversight and Accountability Commission to support and further invest in the Mental Health Student Services Act program that they already had going. It allowed for further investment in existing, but also allowed them to bring on additional counties to that program.
Thank you both. Question for the panel: how are youth that are experiencing homelessness being engaged with this initiative?
I'll start off by sharing that we are working with partners. Earlier this year, we conducted a series of expert interviews with organizations throughout the state who are engaging youth and families directly in health, particularly in the health and behavioral health arena, to hear from them about really the ways in which, if the Children and Youth Behavioral Health Initiative wants to do thoughtful, authentic engagement with children, youth, and families, what approaches should we be taking? And one of our commitments as we continue to develop that work and really evolve our efforts to engage children, youth, and families will be to make sure that we have a diversity of voices and partners in that work. And so that would be our hope, is that through our engagement with local, community-based, trusted partners in the field, that we would make sure we're trying to engage a variety of youth and family voices in the process.
Thank you, Melissa. This question may also be for you. Who would be the best contact on this panel for working with justice-involved youth? We work with young people in the juvenile halls and returning to the community.
Yeah. Thanks for the question. I think this is an area where, yes, we are very committed to working with various efforts that are already underway, like the Office of Youth and Community Restoration, the new OICR, to think about the ways in which we can connect the work of the Children and Youth Behavioral Health Initiative to efforts that are around specific populations of youth, including justice system involved youth. So we'll look forward to continuing to think about those partnerships and those opportunities to connect. So thinking about, for example, are there particular ways in which the virtual services platform that Autumn and the Department of Healthcare Services are leading the way on could connect to addressing certain needs that particular populations may have? So I appreciate that question.
Thank you. For DHCS, would it be possible at this time to provide clarification on what the capacity grants would fund? Infrastructure, capital investment, or other?
We don't yet know what the grant design is as we're engaging in our stakeholder process to really hear from stakeholders around the grant design and eligible recipients. That process will begin in April and will continue through to July. However, just if you look at the statute, there's three kind of possible avenues for how we fund the grants. We can fund to strengthen partnerships between school sites, LEAs, and community-based organizations, or health plans or counties, for example. So partnerships is one example. There's also infrastructure. So the statute speaks specifically to kind of technological infrastructure and needs that may be needed at school sites in order to facilitate telehealth, for example. We also could use the funds to support capacity building at the school sites. We don't know what that looks like just yet. And like I said, we'll be engaging with stakeholders over the next several months to narrow down the grant design, but certainly open to proposals, and have met with some partners on the education side, as well as hearing from some youth advocates who have already provided some really good ideas about pathways that we might take in terms of how to fund the schooling partnership and capacity grants. But we'll really be hearing from our partners in education, from our community-based organizations, health funds, and counties to better understand what the needs are, so that we can make decisions about the best way to leverage and utilize the available funding. We'll also be partnering with our institutions of higher education and the chancellor's offices from the California State University system, the University of California system, and the California Community Colleges systems in order to understand the needs on college campuses. And I mentioned earlier, we're also engaging in a series of listening tours with partners from the early education space. So lots of work still to be done. That's a long way to get at. We don't know yet, but that's where we're at today.
Thank you, Autumn. So we have a similar question. We discussed earlier, how are we going to be reaching youth that are experiencing homelessness? There's a similar question about our strategies for engaging children and youth who are in foster youth and similar systems of care. Melissa, can you take that one?
Sure, thanks, Nate. Yes, I think many of you on this call are probably engaged and very familiar with the work that California is doing around developing a system of care for foster youth. And similar to what I mentioned with justice involved youth, we are very much thinking about where are the opportunities to think about the tools that we have within the workstream components of the Children and Youth Behavioral Health Initiative, and how those might be able to be brought to bear or connected with the work that is happening to address the specific needs of foster youth. So I don't have answers yet to what that looks like in terms of what are the most important connection points to be made, but I really appreciate the question because I think it's an important one for us to think about how we connect the work of the Children Youth Behavioral Health Initiative, because the goal is not to create another silo, right? I mean, that is not our goal. Our goal is to really make sure the work of the Children Youth Behavioral Health Initiative is connected to these other bodies of work that are already in process. And related to that, I'd also just note that the work around system of care, which, as you know, is very much interagency. I think we're also trying to think about how do we learn from that effort, because this is also very much meant to be not only a cross-department body of work within Health and Human Services, but across agency work, cross-sector work with our education and other partners, as you've heard today. And so I think we are also looking to continue building on and learning from other efforts, both at the state level, but also at the local level, in building systems of care about really what does it take to do meaningful, impactful, interagency, cross-sector work together to really do this work together of building and sustaining an ecosystem approach.
Thank you, Melissa. I guess while I have you, I've got a follow-up. Will a youth advisory board be established for ongoing feedback and input for the initiative?
Yeah, thanks for that question. We are working right now on a structure and approach that came out of those expert interviews that I mentioned we spent the last couple of months doing, talking with some different groups. And the approach that we are working to stand up right now, we'll be working on in the coming months, is to develop and partner with a couple of lead partner organizations to develop a network of children, youth, and family engagement organizations throughout the state that we would be able to engage in an ongoing way and in different ways. One of the things we heard from those expert interviews was, use a variety of approaches and mechanisms, not just one. So a mix of surveys and focus groups and workshop design kind of sessions, and make sure that you're doing engagement in spaces that are youth focused or family focused, and make sure you include youth and families in more cross-sector, cross-agency spaces and cross-generational spaces. So we're really trying to take all the advice and insights from those expert interviews to heart and stand up an approach to children, youth, and family engagement that reflects those observations and insights from our expert partners. Whether we actually form sort of a single youth advisory group at the state level is still an open question, mostly because we want to start working with some lead partners to get this engagement network into place. And if standing up a sort of an overall youth advisory group for the initiative can be done in an authentic, meaningful way, we'd be very interested in doing that. But we also want to be mindful about making sure we're doing really meaningful engagement and not doing something that is not sort of deepening that engagement in a thoughtful way. So we're very open to that possibility, but we want to be working on that with some of our partners who will be helping to lead us to create this children, youth, and family engagement network.
Thank you. Questionably for healthcare services. Will local government jurisdictions and cities be eligible for any funding related to this initiative to provide school-based services for all children and not just Medi-Cal beneficiaries?
So that's still to be determined. We will be working with stakeholders to determine the grant design and eligibility criteria for the grants. And so, definitely an option. And as I went through the slides earlier, in the statute, county behavioral health departments, for example, are specifically named as one of the potential eligible recipients. But we need to conduct our stakeholder process to determine the grant design for both the school-linked partnership and capacity grants and the evidence-based practice grants. It is likely that there, especially for the evidence-based practice grants work stream, that county behavioral health departments would be eligible recipients, since the idea for the evidence-based practices is to scale evidence-based practices statewide and across delivery systems. But I hesitate to make any commitments today since we have not yet started our stakeholder process.
Thank you. Question for DMHC. With this dramatic expansion in public investment to our county systems and nonprofits, how can we ensure that commercial health plans are not dumping patients onto public programs?
Well, I think through the initiative, we're kind of turning that on its head by saying if there are services that traditionally have had an obligation to be covered for an enrollee of a health plan, now that individual will be able to get those services on school sites where they haven't in the past. So I think that's exactly what the initiative is trying to do, to ensure that commercial plans pay for services for their enrollees.
Thank you, Amanda. Okay, question for the panel. How are we working with the Family First Prevention Service Act, or FFPSA?
This is Melissa. I'll start, and then my colleagues may want to add. So as you've heard throughout today, one of the areas of focus for this work is thinking about what are the opportunities to more fully embed upstream prevention work and strategies and efforts into the ecosystem overall and throughout the various bodies of work that are part of the Children and Youth Behavioral Health Initiative, as well as through other bodies of work where there is that connection. So as we are thinking about how to really create this ecosystem through supporting different kinds of partnerships and collaborations and efforts, we are very mindful of the need to be thinking across the entire continuum, including about how do we shift the system to be more upstream and prevention focused. We know that that is a sort of a priority for this work. So I think connecting to all of the various efforts that are building out the prevention landscape is a really important part of the work, including the FFPSA.
Thank you. Question for the panel. Are any of these work streams addressing the intersection between education and behavioral health? For example, preventative education in the classroom, in social and emotional health, conflict resolution, coping skills, etc.
So thanks for the question. I mean, I think that there are several components of the initiative that will address social and emotional learning environments. I spoke earlier about the CalHHS Student Services Initiative, which is focused on enhancing school social and emotional learning environments in schools. And I think we're trying to be thoughtful as a state, and thinking about how we can best kind of create environments in schools where behavioral health services are more readily accessible, but also how we can better support teachers and support staff on school campuses to continue to foster those social and emotional learning environments. So lots of focus on that in our upcoming stakeholder engagement efforts, and definitely a part of the conversation around various components of the initiatives as it relates to the school-based services.
And this is Melissa. I would just add to that really great information provided by Autumn that we really are committed to engaging with our education partners to really understand the framework in education, which some of us, myself included, have been really learning about, who come from a health background, and really understanding things like the multi-tier services support system, the MTSS framework that many school districts utilize, and in thinking about the different tiers of strategies and supports and services that are a part of that, and how might this initiative link to those so that we are sort of maximizing our collective efforts across sectors. Because obviously we know that our education school partners are also doing a lot of work in this space of supporting the social emotional well-being of children and youth. So again, how is it that we make all those puzzle pieces fit together in a way that is really centering and having the greatest impact that collectively we can have together to support the well-being of our children and youth?
Thank you both. Melissa, I have a question for you. It seems that there should be an overall advisory group to review and support keeping equity at the center of all of these. Otherwise, how will this be authentic and accomplished just by state staff?
Thanks for that question. So I think there's a couple of ways in which we are really trying to work to ensure that, to the sort of point of the question, I think that equity is authentically embedded and centered in the work across the Children and Youth Behavioral Health Initiative. So one is some of what you heard about today, which is really having very extensive stakeholder involvement and engagement throughout all of the work of the initiative, where we know our partners are going to be bringing ideas about how we can address inequities in the current system, both in terms of access and outcomes. And I know we all look forward to hearing those ideas and thoughts around how do we address inequities in the system, and what are the ways in which the various workstream components and the initiative overall can take that on. And I think in terms of the 5-year outcomes goals that we will be developing for the initiative, those will also incorporate thinking about equity and addressing inequities in our 5-year outcomes goals. We are also looking to form a couple of working groups that are on cross-cutting issues across the initiative. So they are related to all the work streams, but not unique to individual work streams per se. And one of those areas where we are currently considering forming a working group for a cross-cutting issue is on equity to this question, and both to help support all of the work we're doing at the initiative level and across the different work streams about what are some of the processes, what are some of the approaches, how do we best use data in order to really center equity. And we're in part modeling this after the work of the Master Plan on Aging, who also formed an equity advisory committee as part of their work. So really appreciate their leadership in this area. And we are in the process of considering, can we form an equity working group to help guide centering equity across all the work of the initiative.
Thank you. It seems as though we may have time for one more question. So this question is for healthcare services. Autumn, what is the dyadic services benefit?
The dyadic services benefit is a new benefit in the Medi-Cal system, Medi-Cal delivery system. It'll be implemented in January of 2023, as I indicated, and it'll be an opportunity for services to be provided to a parent and child, or caregiver and child, at the same time, which is the dyadic nature of the service. So there's more information about dyadic services available, and we can share some follow-up information about the benefit that is being made available. But that's kind of in a nutshell what it's about.
Great, thanks, Autumn. So I know we're at the close of our time today. I want to thank everybody again for attending and participating in today's webinar. I want to note that we will be posting the recording, but also the slide deck on the CalHHS website, as Assistant Secretary Mitchell noted earlier. I know there were a few notes in the Q&A around being able to access the various links that are in the presentation. So Nate, correct me if I'm wrong, but I believe once we post the presentation on the website, those links will be live and people will be able to use them. Okay, great. So we will work on getting that posted quickly so that you will have access to all of those links that were in the presentation. And also, I know there was a couple of comments and questions as well about sort of how folks can track sort of the different opportunities for stakeholder engagement. So as you heard today, each of the departments is developing their stakeholder engagement plans for each of the work streams. We are cognizant of trying to provide information in a way that is accessible to all of our stakeholders and partners in the work. So appreciate folks lifting that up, and we will try to think about a way that we can at least maybe provide a sort of a landing place where maybe you can connect with some of that information in terms of the work that each of the departments are doing to engage stakeholders around the individual works. So I want to again thank everybody for joining today. I hope this information was useful. The recording and the slides will be posted. And as noted, we really appreciate all of the questions, and we did not get to all of them, so we will work on an FAQ-like document for those that we did not have time to get to Tuesday. So I want to thank my colleagues and thank all of you, and really just express our energy and excitement for the work ahead with everybody to do this work to support the well-being of children and youth in California. Thanks, everybody. Take care. Have a good rest of your Tuesday. Bye-bye.